Well, the next steps for the AstraZeneca vaccine are on pause this morning, just like first doses in much of the country. Here's a look at where things stand. The provinces highlighted in orange are now holding off. BC and Saskatchewan say it's because of supply. Others because of concerns over the vaccine's link to rare blood clots. New Brunswick is still considering what to do. Prince Edward Island expected to make an announcement today. Only Quebec says it will keep using AstraZeneca for first shots. Our coverage begins with Laura McQuillan. This is Canada confirms it will be receiving even more doses of AstraZeneca next week. Laura, a lot to unpack here. What's the latest?
Yeah, John, you mentioned those provinces now holding off, and that is because of that rare blood clotting condition we've been telling you about for a couple of months now. As concerns have grown over it, as more cases have been identified, especially in Ontario, that's what's prompted a number of those provinces to hit pause and to say that they will only give those second shots. They will no longer do first shots. That's also what we heard from British Columbia yesterday, even though it is citing supply issues, but saying that it will not give out any more first dose appointments with AstraZeneca. We saw Nova Scotia say the same, saying it's doing so out of an abundance of caution. So you can see a few mixed reasons there for this. And you mentioned PEI. We heard their Premier speaking in response to questions in their legislature yesterday, suggesting they will also pause the use. Not 100% confirmed, and there is expected to be an announcement on that later today. But here is what he said yesterday.
I don't want to say it's better because I don't want to diminish the others, but it's a more protective vaccine, the mRNA vaccine, so we have an abundance of that here now. Everybody who will be vaccinated by the end of June, the 80% mark, Mr. Speaker, including those 12 years old and up, will be done so with the mRNA in this province. I think that's the way we're going, quite honestly.
And we did see Quebec, sticking to its guns about using first doses, but they in New Brunswick saying they will listen to medical experts in each of their provinces on what they think should be done. So watch this space for possibility of changes in either of those provinces. But when we talk about supply, John, as you mentioned, a huge load of the AstraZeneca vaccine due to arrive next week, 655,000 doses. The supply has been so uncertain that it's made it really hard for provinces to plan those shots. And for instance, Ontario right now has 50,000 doses on shelves. It's set to get about 250,000 more next week, but it's holding off doing anything with those until it gets some more advice from the government. Keep in mind also those shots coming next week come from the COVAX initiative. It is an organisation set up to distribute vaccines to lower income countries, but Canada has been dipping into that as well. And that's all raising some questions. If Canada no longer wants AstraZeneca, why is it taking these doses away from COVAX?
So all of that has people wondering about the possibility or the real eventuality perhaps of mixing vaccines, and we've got new data from the UK on that. What do we know?
That's right. So these are early results from a trial that only had about 800 participants in it, but the early signs are that if you were to get AstraZeneca as your first shot and then a Pfizer shot for your second dose, or vice versa, that you are more likely to have some mild to moderate side effects from that. We're talking things like fatigue or a headache or a fever, but those are short-lived and there are no safety concerns that have popped up from those side effects at this point. Now that's an increase compared to if you just got 2 AstraZeneca shots or 2 Pfizer shots. But this mixing and matching is something that people around the world are increasingly looking at, in part due to supply, in part due to those concerns about the blood clotting. We spoke with Dr. Sumon Chakrabarti, who is an infectious disease specialist, for his explanation of what these increased side effects might mean, and he pointed to it possibly being a good sign. Take a listen.
People are having more mild to moderate side effects with the second dose. This is all that we have so far. That to me actually suggests that that vaccine combination is very immunogenic. It's really eliciting an immune response, which likely is going to give you very good protection. We have a precedent for that with other vaccines where you mix 2 different types of vaccines, for example, with pneumococcus, and it actually gives you better protection than the same vaccine twice. So we'll see what happens. It's an option that we have for many people who have already gotten AstraZeneca.
We'll have to wait and see a few more weeks for more data on that front, John, just about how effective it is. Another important point in the meantime, if you do get a second AstraZeneca shot, there is a lower blood clot risk, much lower, associated with that second shot. So a lot for the provinces to weigh as they come up with a decision on what to do about those second doses.
Thanks for this, Laura.